But turning now to the state's healthcare workforce, which was facing challenges even before the arrival of COVID-19, a shortage of medical professionals during the pandemic led then Governor Andrew Cuomo to issue an executive order giving physician assistants autonomy to act without traditionally required oversight. After operating with this flexibility for a couple of years, PAs are now looking to the legislature to make this expanded power permanent. For more on the issue, including the role PAs play in the healthcare system, we spoke with Patty Cortaz, a PA and the president of the New York State Society of Physician Assistants.
Patty, thank you so much for being here. I appreciate it.
Oh, thank you for having me.
So this situation is kind of from birth of the COVID pandemic. And I want to talk to you about first, how were PAs operating before the pandemic? This was a big change when the pandemic started. What was it like before?
Well, PAs are trained in the general medical model. We are all generalists. You know, we go to school. When we graduate, we are licensed in the state of New York to practice everywhere. And so when we then get a job, that's when there's a lot of on-the-job training. So PAs can be in orthopedic surgery, PAs can be in neurology, PAs can be in dermatology, the emergency department. So as a PA, we have a very broad scope. And so PAs were working, like for me, I worked in the emergency department and in the surgical ICU and in oncology. It's really dependent on actually PA's personalities. You know, some people are drawn to one and some people like to do different things or they're good at it. So that was before COVID.
Okay. So once you get to that schooling, you go out into the profession. Let's turn to the bill that we're talking about. It's born, again, like I said, from the COVID pandemic. There was this executive order that allows PAs to practice without the supervision of a physician. And that was originally designed because there was such a great healthcare need during COVID. Do you still see that healthcare need in facilities today?
Even worse. I think that COVID highlighted a lot of the issues with access. Obviously, a lot of the access and the need was in the critical care areas, right? In the emergency medicine departments and in the ICUs.
Sure.
Before COVID, just to be clear, the physician supervision was always never on site.
Right.
Right, never in the same place. I worked, for example, in the surgical ICU, and I texted my attending at the time, or the attending of the day, as long as there was some communication. When COVID occurred, I think that everyone realized, including the governor at the time, that PAs were really flexible and nimble, and the training allowed to bring PAs that were no longer doing orthopedic surgery, because there was no orthopedic surgeries happening, to bring them to the emergency department where they were needed. And what didn't allow for that easily was this tethering of one PA to one physician.
Right.
That's where the executive order came in and basically removed that level of supervision. And that's why it was, it really allowed the PAs to be utilized really where their skills were needed the most.
So this ends on May 22nd. This will air after that. What do you think the consequences are of this executive order expiring? Like how would we see our healthcare system shift?
So, COVID highlighted all of that. The executive order has been renewed every month since March of 2020.
Right.
And here we are in May of 2023. And it is one of our biggest concerns that, even though COVID is no longer a pandemic, the pandemic that does exist are the desert areas.
Yes.
Where right now PAs are taking care of panels of patients, and those patients may lose access to their provider when this executive order expires.
And I want to clarify the bill, because the bill is not saying that you go to PA school, you get out, and now you don't need physician supervision. The bill says if they have practiced for more than 3,600 hours. How long would it take a PA to get there? Because I timed it out. It's 458-hour work days, 90 weeks. But I'm assuming it's not that short because you're not working every day.
Well, that's right. It's about 2 years.
Yeah.
The 3,600 hours really is for parity with what the nurse practitioners got last year. And, but the reality is that no one works and practices by themselves. We all work in care teams, all of us. You know, what we really would like the bill to do, and what it says it does, is it just removes that tether of supervision. That's it. So we are not tethered to one physician. But the reality is that we all work in teams. If you go to the emergency department, you see that there's teams of people. You know, you never see, and now the independence, you know, of one single doc or one single provider is really no longer the case for a lot of reasons.
Yeah. You know, when I'm thinking about this issue, I think about trips to the emergency room that I've been on, where I see exclusively a PA who, you know, will tell me what's wrong with me, give me some care, hopefully. But what I also notice is that there are just not enough people working in these hospitals and emergency rooms. Do you think that this change would help that, attract more people to being a PA so we can fill these gaps?
Yes, absolutely. Right now, it is a bit difficult to get into PA school, but there are 28 programs in the state of New York, over 250 programs in the entirety of the United States, and growing. Because the profession is growing, it's grown 74% just in the last 10 years.
Wow.
And it's projected to grow 30% just in the next 7 to 10 years as well. So yes, absolutely. The patient access, you know, the barrier to access, whether it's patients with Medicaid or commercial insurance, really is getting to see that provider. It's not even about specialists, it's that provider.
Now, I want to end by talking about the training and the experience of PAs, because I imagine some people may think, well, I don't know if I want to be seen by a PA versus a physician, and I'd like you to kind of qualm those fears. Tell me about what goes into that training and what goes into that clinical experience that qualifies PAs to do this.
So the training is incredibly rigorous. You know, the joke is, you know, say bye to your family and your friends once you go into PA school, because it is 9 to 5, just in didactic for an entire year, every day. It is ingrained in all of us because of our curriculum, which is a nationally credentialed ARC PA. It is ingrained that the patient is first. The patient is the center of everything. And because of that training, we also know that, you know, we are generalists. So when the patient needs more care, because we are in a care team, and that's been part of our training, we always go to where the patient needs care the most. So even for myself, I've been a PA for 23 years. I worked in the emergency department, as I mentioned. I worked in ICU. I worked in the ICU taking care of incredibly critical patients, but I wasn't by myself.
Right.
You know, and I always work with the nurses, incredible nurses, and some of the physicians that were specialists, but they weren't sitting in the ICU with me. You know, whatever the patient needed at the time, I would always make sure to go to the level of care that the patient needed. That's our training.
You were the person in the room when nobody else could be in the room, I imagine.
Exactly.
It's a big role of PAs. Patty Quartas from the New York State Society of PAs, thank you so much.
Thank you for having me.